Nationwide, the number of COVID-19 cases has climbed again. 600 people are now infected. At least 26 have died. Most of the deaths are in Washington state.
Health reporter Stephanie Stahl is here with more on the first case in New Jersey and details on how health officials are trying to contain the spread.
Oh boy, lots going on with this. The U.S. Surgeon General says communities will need to start thinking about canceling large gatherings, closing schools, and letting more employees work from home. A New Jersey patient with COVID-19 is speaking out from inside the hospital, and he's worried about his recovery. James Kai is New Jersey's first confirmed case of COVID-19. Hospitalized at Hackensack University Medical Center, he says he feels uncertain about his recovery.
Every day is getting worse.
Kai, a 32-year-old physician's assistant working and living in both Manhattan and Fort Lee, New Jersey, says he became sick after attending a medical conference at a Times Square hotel last weekend. He went to an urgent care clinic and then to the hospital. In Pennsylvania, the Secretary of Health says there are now 10 confirmed cases in the state, 7 in Montgomery County, and officials are tracking everyone that came in contact with the individuals who tested positive for COVID-19.
And we are taking all appropriate public health actions. This includes what we call contact tracing. Contact tracing means that we are reaching out to anyone who came into direct contact with these individuals to see if they have developed symptoms and if they need to be tested. We are in constant communication with our county and municipal health departments across the state, including Montgomery County. Identifying and temporarily isolating people who may be infected is a critical part of stopping the spread. Most people who test positive are able to safely recover at home. There is not a treatment for COVID-19, but some cases, like with Kai, can cause serious lung problems.
They did a CT, found out I may have corona. So it happened so quick.
Now, that case appears to be unusual. Kai is young and was healthy. Doctors say most serious cases of COVID-19 are in people who are elderly or have other health conditions, but the vast majority of cases are mild. Big spread in this, though.
Yeah,
for sure.
interesting. Thank you.